The first item on our agenda today is House File 402 by our own Representative Bierman. Representative Bierman, would you like to move your bill?
Yes, please, Mr. Chair.
Representative Bierman moves House File 402 be recommended to be re-referred to the Health, Finance, and Policy Committee. And Representative Bierman, you have an amendment to the A1 amendment. Would you like to move your amendment?
Yes, please, Mr. Chair. I'd like to move the A1.
All right. And would you like to describe your A1 amendment?
Yeah, the A1 amendment is the draft that we had presented on Monday regarding mergers and how we will hopefully move forward on mergers in the future.
Wonderful. Any members, obviously this amendment is a substantial addition to the bill, and it's what we'll mostly be talking about. This is getting the bill in the shape that the author would like the committee to consider it. Any discussion to that amendment? Understanding that we'll have discussion once it's adopted as well. Seeing none, all in favor say aye. Aye. Opposed? Motion prevails and the A1 amendment is adopted. Representative Bierman, to your bill.
Thank you, Mr. Chair. Thank you, members, for allowing me to present House File 402. This bill is designed to do two things: protect public assets and promote better health. I believe this is a goal we all share. In my comments about the bill on Monday, I stated that we stand at another intersection where corporate health services, which underpins our delivery model, meet the public health requirements we in the legislature are bound to facilitate. And that to do this task, we need to obtain a clear vision of significant changes to our healthcare landscape brought by mergers. Mergers can affect price, accessibility, and quality care across the state. This bill will help guide us in our mission. So, Mr. Chair, that's all I have, and we can go ahead and have discussion. This bill, as I understand it, will move to health next, and so there will be plenty of work ahead of it, but I'm anxious to hear what members have to say and their thoughts and opinions. Thank you.
And just to remind the committee, we did have Representative Bierman kind of explain his proposal in more detail when we last met. There was some public testimony to the bill. That's behind us, so we're going to move directly to member questions and discussion. Did I see you had your hand up, Representative Farr? No? Oh, Representative Farr.
Thank you, Mr. Chair. Representative Bierman, so I heard from the Attorney General last week that if he was going to be looking at the merger and if he concluded that it didn't violate any state statute, that he would let it go through, and then if it did, we would take a look at what those issues are. So what's the purpose of the bill? Are we creating another roadblock or creating statute that that will stop this merger?
Representative Bierman.
Thank you, Mr. Chair. I would say we are doing our due diligence on public assets and making sure that we do have to wait to find the determinations of the Attorney General and go from there, but this at least gives us an option to proceed to protect those public assets if we find that protection is needed.
Representative Farr.
Thank you, Mr. Chair. And any idea how long this process is going to take if this bill is implemented and the Department of Health is looking at this? How long are we going to give them to assess that?
That's a very good. Thank you, Mr. Chair. That's a very good question, Representative Farr, and that is one that I'm working on actively trying to find out what sort of timeline it would take. Obviously, different sized mergers would have different requirements and different amounts of time to assess them. But I think, I look at due diligence on such a merger and a transforming potential impact to our total Minnesota landscape healthcare as something that we shouldn't be in a rush to do it. We want to do it right.
Representative Liebling.
Thank you, Mr. Chair. And I just really wanted to thank Representative Bierman for carrying the bill and taking the lead on doing work on this really important issue. I really view this as about far more than the merger that was discussed in our last meeting. we know that it is completely in the public interest to make sure that we have a well-functioning medical care system, healthcare system, that is available, accessible, and affordable to everyone in our state. This is critical stuff. This is life and death stuff. And not only that, but we have the charitable assets part of this. So these are mostly tax-exempt organizations who are getting an enormous tax benefit from the state of Minnesota and its people. And it really behooves us to set up a regulatory structure where we can examine whether mergers or, for that matter, transfers of charitable assets are in the public interest. And I just want to be very clear that I think Representative Bierman said it very well, and I think he's right, that there is a lot of work still to do on this. We need to get this right. We need to make sure that the agencies involved are properly resourced and able to do this work, and that we have proper oversight from beginning to end. But this is something our state needs, irrespective of this particular merger. And so I think that the merger that we've discussed is, or the potential merger, really just kind of lights a fire under us to get this going and get the right minds in the room and figure this out, because you know, we have this public-private system of healthcare, and we need to make sure that it does actually work in the public interest. And so I just appreciate Representative Bierman taking this on and continuing to work on it, because it's a heavy lift, and there are a lot of folks who need to be involved and have their voices heard, and I just really appreciate that he's willing to do that. Thank you, Mr. Chair.
Thank you, Representative Liebling. Representative Niska.
Thank you, Mr. Chair. Thank you, Representative Bierman. The two issues that I've heard in this and from yesterday, and maybe you can add to this list, but it seems to really be focused on the charitable or state assets that are involved in a healthcare merger and the competition concerns that might be raised. And both of those things are really sort of within the authority and currently statutory authority and common law authority of the Attorney General, and frankly in the expertise of the Attorney General's office. You know, the charitable assets does go back all the way to the common law powers of the Attorney General, and there's a lot of antitrust enforcement that the Attorney General's office already does. Is there some reason why the Attorney General's office is handicapped in its current powers and ability to review mergers in the healthcare space, or what's the reason for adding another agency into that mix in an entirely different review process than what we currently have with the Attorney General's office?
Representative Bierman.
Thank you, Mr. Chair. Very good question, Representative Miska. One of the issues I think one of the issues that I think is very pertinent to this is that, you know, the Minnesota Department of Health is uniquely situated with the data and the information that is reported, and they're working on a daily basis about everything in healthcare, from, you know, the entire network that is operated and kept up and maintained to make sure that we have network adequacy. So I think they need to be included in this process, and I think they're an ideal partner for it.
Representative Niska.
Thank you, Mr. Chair, and thank you, Representative Bierman. Just so I can understand better what the problem is in the status quo that you're isolating, is there some barrier that prevents the Department of Health right now from cooperating with the current Attorney General's robust review process having to do with competition issues and public asset issues that are involved in healthcare mergers as we stand now?
Representative Bierman.
Mr. Chair, Representative Miska, there's not anything as robust as what we do say on some of the areas of hospital moratoriums, for instance, where you cannot build a hospital without a process that is done, that is public, that is then brought to the legislature to approve a new hospital or even approve new beds. So they don't have that authority to oversight in this area. This is something truly lacking, as Chair Liebling mentioned. It is something that we do need to add in spite of this merger and just going forward.
Representative Niska.
Thank you, Mr. Chair. I don't have any further questions other than to comment that it's still, I guess, a little unclear to me exactly what the problem is with the current Attorney General's review of the process. It seems like this is kind of, we're rushing to add another roadblock, maybe not necessarily a process that has been vetted out. I think it sounded to me from our previous hearing that the Attorney General is actually taking a pretty robust and careful look at this, and I'm not sure why we need to add another bureaucratic step into the mix.
Representative Cleavorn.
Thank you. So, forgive my ignorance, there's a whole lot about the healthcare industry in Minnesota that I don't know a lot about. But I have found that it's been interesting working in the long-term care space and then thinking about our healthcare systems with higher education. So that's
Representative Cleavorn, I'm sorry to interrupt, but would you mind speaking into the microphone so that
Sorry about that.
it's not for people so much in the room, but also for the broadcast? Representative Cleavorn.
Thank you so much. In my work through long-term care committee and with higher education committee, I think about our hospitals that are functioning as nonprofits and the state allowing that nonprofit status. But what I'm noticing is that buildings are being transferred into real estate investment trusts, and I don't know what the oversight is for that in these systems, and we're not privy to which of these buildings may be transferred. And then the healthcare entity is responsible for liability, maintenance, and costs associated with it. And then the rents are then going into these investments that are then given another tax-deferred treatment. And I'm wondering, do we have any idea as to what these systems are doing with those charitable assets? And would that be addressed by your legislation, or do we, and then do we have any idea, and is there a space where the investors in the real estate investment may have a conflict of interest because they also sit on the boards of these hospitals or manage our care facilities? I know it's a complicated question.
Representative Bierman.
Yes, complicated. We are dealing with big business, which is healthcare. Healthcare is big business. So there are all sorts of models out there that are incorporated to serve the healthcare needs, but also turn a profit for various investors, which is fine. We just need to be aware of, what is transpiring between mergers, particularly in this bill regarding hospitals and medical facilities, and understand, the impacts of those on the general health of the complete system and how that will either help or harm. And I think having this information and having this process will help us take care of some of that. But it certainly is not going to fix all the issues of healthcare and high costs that we're faced with. And we just need to keep working on some of those other issues. It's only recently that long-term care has come under the microscope a little bit and had some control on purchasing of those facilities. So it's a big issue and one that we have to keep an eye on.
Thank you.
Representative Cleavorn.
Well, I just wonder if we have any kind of inventory as to how many of the nonprofits in our state providing health care have transferred their investments. And I don't know where we would get that information, or can we ask the Attorney General to look into that? I mean, I don't know what our purview is there, so.
We certainly could put that question to the Attorney General's office. I don't see Ms. Sales or anyone from the Attorney General's office in the audience, but we can try and follow up with the Attorney General on that question.
Thank you, Chair Stevenson. That's all for me.
All right, thank you. Representative O'Driscoll.
Thank you, Mr. Chair. Just a little bit of background on before we got here today, and maybe what got us here. to this conversation. Earlier in the state's history, the University of Minnesota and the state had decided that they wanted to divest themselves of certain parts of the medical practice and certain parts of patient care, and they were looking for a suitor to come in and to take that part that the University of Minnesota no longer wanted to support. And Fairview stepped up, and Fairview agreed to assume that, and there were substantial legacy costs with that, and I'm keenly aware of that in my work in pensions in this legislature over the years. Many, if not all, of the individuals who are working for the University of Minnesota that were now moved over to Fairview employees are still eligible to, and as participants in state pension plans, and it's kind of a unique situation because this is a unique situation that we are working under. I have to question in my mind if some of the issues that we're seeing for Fairview right now, and I hate to keep talking about Minnesota businesses that are struggling because there's a lot of them, but Fairview at their own admission when they were here on Monday suggested that they've seen better times and that to try to help to be able to preserve the delivery of health services in the state of Minnesota, a merger is certainly in their best interest and the best interest of their patients. Now, folks can have different views on that. I understand that and different ways of arriving there. My question is, if Sanford, another nonprofit, is going to be merging with Fairview, another nonprofit, some of the issues that were raised today may not really be issues as far as divesting of assets and private corporations earning money or making money on that. So my question to Representative Bierman is, can you point me in the bill as amended to the section that says if these two parties view it to be too onerous for them to continue the negotiations on a merger, what the solution would be if Fairview becomes insolvent and has to close their door for the assets that are under management by them right now that were divested from the University of Minnesota, as well as substantial patient base that they now serve here in the greater Twin Cities area.
Representative Driscoll, can I ask you to, I'm sorry, I don't think that I'm following the question. Could you try and clarify
The
what you're
question
asking?
is, sure, Mr. Chair. The question is, I would like to know in the bill where it says, if this merger, these partners or individuals and the principals that are looking at the merger choose not to go forward and Fairview fails, what's the fallback plan to take care of those legacy assets that they are managing that the University of Minnesota used to have, and to provide health care to the individuals in the greater Twin Cities area who rely on Fairview and their adjunct facilities to be able to provide medical and health services?
Representative Bierman.
Mr. Chair and Representative O'Driscoll, there is no line in the bill that would assure under circumstances where Sanford and Fairview do not come to an agreement and the bid fails to transpire, there's nothing in the bill that would fix that. That's not really what the bill is addressing. The bill is addressing coming up with a process for maybe this merger, but all future mergers to look at the impacts on the healthcare landscape in Minnesota when significant mergers such as this occur and what the impacts are for the citizens of this state and their needed health care.
Representative Driscoll.
Thank you, Mr. Chair. So a piece of legislation like this, although well-intended, may have some negative consequences on the principals who are involved in this type of merger. I always get skittish when the legislature or my days in local government, or we were going to step in and try to fix things and make them better right in the middle of negotiations under a former set of rules. Because when the rules change, the partners may walk away, and the state's going to need another bill or something to figure out how they're going to resolve those assets that are no longer being used or available because of a closing or a failure or a shuttering of a major medical facility that, again, is dealing with legacy assets of the state of Minnesota that the state felt it was having difficulty managing as well. Thank you, Mr. Chair.
Representative Daudt.
Thank you, Mr. Chair, and thank you, Representative Bierman. I apologize for having my back to you here. Just curious about the cost of this bill, and if we've got a fiscal note, where that fiscal note is. If there is no fiscal note, what do we estimate the cost to be, Representative Bierman?
Representative Bierman, I'll just note, we have requested a fiscal note. The committee staff has, it is not completed yet, but Representative Bierman, happy to.
Thank you, Representative Stevenson. Thank you for the question, Representative Dowd. We will be waiting on the fiscal note. There's still a few items there trying to work through on that.
And Representative Dowd, just to add, the bill's going to the Health Committee. The commissioner and the agency that would incur costs would be expected to be the Health Commissioner and the Department of Health.
Yeah,
Representative Dowd.
yeah, thank you, Mr. Chair, and I appreciate that. I only serve on this committee, and as you know, I have an interest in the state budget, so I would like to see the fiscal notes on these bills, you know, as the bills are in our committee too, even if the budget doesn't come out of this committee's budget. I think, you know, not every legislator sits on every committee. And I would ask that we maybe put the brakes on a little bit on some of these bills. This committee has yet to see a single fiscal note on a bill that's gone through its committee, so I'd appreciate to see those in the future.
Representative Liebling.
Thank you, Mr. Chair, and thanks for letting me speak again. I just wanted to engage a bit in this conversation. I appreciated Representative Driscoll's comments and wanted to respond a little bit because I do think that the financial health of these systems is of great concern to everyone. But I guess what I would say is that I guess I would ask the perhaps rhetorical question, what happens if any of the health systems we have would fail? What happens if any hospital would fail financially? I mean, I don't know that we have a very good mechanism in place in the state to deal with that. But I think the alternative, if you're suggesting that either we should let people merge let systems merge when they decide, or the alternative is maybe they'll fail, it's kind of strikes me as that may be saying kind of anything goes, let them make the decision by themselves, which I guess is one position. But but I think that your point is a good one, that part of the consideration here does need to be what is the financial health of each of these systems that is proposing to merge. I think some of us might disagree that the merger would actually be a financial solution even for them over the long term. So I do think that maybe Representative Bierman would consider adding to this bill, or I would just ask him perhaps if he would consider adding something about an analysis of the financial health of the systems that are involved in any potential merger and kind of what brings them to this place. Because I think part of this has to be, does this look like it's something that's really likely to address their financial stability? You know, what's going to happen to the additional resources if there are any, or, you know, I guess what I would just say ultimately is there is still a lot of work that does need to be done on the bill. And I think that the consideration you raise is a good one, but I don't think it's a really effective criticism of the bill to just suggest that this will slow it down and then, oh no, they might fail. Because that assumes that the merger is the answer in the first place, and I'm not really sure that it is, certainly not for the whole state.
Representative New Brindley.
Thank you, Mr. Chair. And I just want to go on the record with a couple of things. One, there is a difference. While it's true there is no mechanism right now to deal with failing hospital systems, that there's no technically state responsibility in that, there is a difference when the state is choosing to be involved within the middle of that transaction. That does bring on a different level of responsibility for the state if then there is failure. So I think it's important to draw that distinction. And I would also say, you know, there was part of the conversation over here was talking about investors and these things. Well, these hospital systems are not for profit. These hospital systems, they do not have investors, they do not have shareholders, they do not have dividends. There is no stock options or ownership. These are nonprofit hospital systems. If there is a positive margin, that is going back into delivery of services. It's not going to shareholders or anyone else. So I think that's an important distinction here. And I would just add to the comments, you know, I mean, the Attorney General the other day, I think, gave a strong indication that he's engaged in a robust process. He already has that authority. He's very engaged. All of the parties are cooperating in that. This just feels like a very political move on an issue that, frankly, as much as I know that all of us around this table would like to believe that we are the smartest people in the room all the time, we're just not. And when it comes to this level of transaction and this level of merger, I'm just not sure that I'm not sure that we are the right people to step in the middle of such a transaction and suggest that somehow we are smarter and know better than the folks who are dealing with these issues day in and day out. Certainly, Fairview and Sanford are more aware of their own financial situations than any of us are. And they are probably best equipped to ensure their solvency moving forward. Thank you, Mr. Chair.
Thank you. Representative, so I do want us to move towards a vote. The people who are left on the list have already spoken once, so I'd ask them to be kind of brief in their response. I do want to give Representative O'Driscoll a chance to reply, since Representative Liebling was replying to Representative O'Driscoll. But I'm just going to ask everyone to kind of be brief as we move to a vote here, because we have a lot of people waiting for the next bill. Representative O'Driscoll.
Thank you, Mr. Chair. And to the comments of my colleague, Representative Liebling, it's encouraging to hear that we are recognizing the great stress that businesses, including medical providers and healthcare providers, are experiencing in the state of Minnesota. I will predict that this is not going to be the only merger that we're going to be seeing of substance going forward. Minnesota's landscape and way business is being conducted in this state is changing very rapidly in this state. And will maybe for the next few years. And that's going to cause more difficulty, I believe, for businesses to be able to stay in such a fragile market, that we're going to have not just healthcare providers that are going to need to be merging and doing things to be able to survive. We're going to have many other businesses that we haven't even contemplated yet that are going to be before the legislature if we enact these kinds of approaches to how we want to deal with mergers in the state of Minnesota. Thank you, Mr. Chair.
Representative Cleveland.
Thank you, and I'll be very brief. Just to the point about hospitals are nonprofits, and that we all get, we all understand. Real estate investment trusts are private equity, and they are focused on profits. And so I want to make sure that whatever assets our state has invested in, that we make sure that that investment is serving the needs of Minnesotans. That's just what I want to say. And I would like to make sure that we are doing our due diligence to make sure that when these mergers do occur, that we are protecting the investments of Minnesotans. That's the goal I think Representative Bierman's bill brings forward, and that is what I'd like to see, and I'm very happy to support the bill. Thank you.
Representative Bierman, do you have any brief closing comments?
Thank you, Mr. Chair. Just a thank you to all members for your thoughts, opinions, and I've written some things down, and good conversation on this start for this bill. Thank you.
Representative Bierman renews the motion that House File 402, as amended, be recommended to be re-referred to the Health Policy and Finance Committee. All in favor say aye. Aye. Opposed, say nay. No. The motion prevails. House File 402, as amended, is recommended to be re-referred to the Health, Finance, and Policy Committee. Thank you, Representative Bierman.